Which theory suggests that dissociative disorders may develop as a result of the inability to integrate and process traumatic memories? A. Psychodynamic theory. B. Cognitive behavioral theory. C. Sociocultural theory. D. Trauma model of dissociation. D. Trauma model of dissociation. The trauma model of dissociation suggests that dissociative disorders may develop as a result of the inability to integrate and process traumatic memories. Dissociation serves as a defense mechanism to protect the individual from overwhelming emotional and psychological distress associated with traumatic experiences. What role do social factors play in the onset and maintenance of dissociative disorders according to the sociocultural perspective? A. Social support buffers against the development of symptoms. B. Cultural beliefs and practices influence symptom expression. C. Family conflict directly causes dissociative symptoms. D. Social isolation is the primary cause of dissociation. B. Cultural beliefs and practices influence symptom expression. According to the sociocultural perspective, cultural beliefs, practices, and social norms influence how symptoms of dissociative disorders are expressed and interpreted. Cultural factors shape the presentation and understanding of dissociative experiences within different cultural contexts. According to cognitive behavioral theory, how are symptoms reinforced in individuals with dissociative disorders? A. Through attention and sympathy from others. B. Through genetic predisposition. C. Through chemical imbalances in the brain. D. Through traumatic experiences during childhood. A. Through attention and sympathy from others. According to cognitive behavioral theory, symptoms in individuals with dissociative disorders may be reinforced through attention and sympathy from others. This reinforcement can contribute to the maintenance of dissociative symptoms over time. Which medication class is sometimes prescribed to alleviate symptoms of anxiety or depression that may accompany somatoform disorders? A. Antipsychotics. B. Benzodiazepines. C. Selective serotonin reuptake inhibitors, SSRIs. D. Stimulants. C. Selective serotonin reuptake inhibitors, SSRIs. SSRIs, which are antidepressant medications, are often prescribed to alleviate symptoms of anxiety or depression commonly associated with somatoform disorders. They work by increasing the levels of serotonin in the brain, which can improve mood and reduce anxiety. What is the primary goal of treatment for dissociative identity disorder, DID? A. Integration of dissociated identity states. B. Symptom reduction through medication. C. Enhancing insight into unconscious conflicts. D. Exposing traumatic memories through therapy. A. Integration of dissociated identity states. The primary goal of treatment for dissociative identity disorder, DID, is the integration of dissociated identity states into a cohesive identity. This involves facilitating communication and cooperation between different identity states to promote integration and reduce dissociative symptoms. Which psychotherapeutic technique is commonly used in the treatment of dissociative disorders to help individuals regain control over dissociative experiences and develop coping strategies? A. Eye movement desensitization and reprocessing, EMDR. B. Exposure therapy. C. Dialectical behavior therapy, DBT. D. Grounding techniques. D. Grounding techniques. Grounding techniques are commonly used in the treatment of dissociative disorders to help individuals regain control over dissociative experiences and develop coping strategies. These techniques focus on increasing present moment awareness and connection to the external environment to reduce dissociative symptoms. Which of the following is a key component of trauma-focused therapy for dissociative disorders? A. Avoidance of discussing traumatic experiences. B. Encouraging dissociation as a coping mechanism. C. Processing and integrating traumatic memories. D. Using dissociative amnesia as a therapeutic tool. C. Processing and integrating traumatic memories. Trauma-focused therapy for dissociative disorders involves processing and integrating traumatic memories to reduce dissociative symptoms and promote healing. This may include techniques such as cognitive processing therapy or eye movement desensitization and reprocessing, EMDR. In the treatment of dissociative disorders, what does the term co-consciousness refer to? A. Integration of dissociated identity states. B. The ability to recall traumatic memories. C. Awareness and communication between different identity states. D. The use of dissociative amnesia as a coping mechanism. C. Awareness and communication between different identity states. In the treatment of dissociative disorders, co-consciousness refers to the awareness and communication between different identity states within an individual. Developing co-consciousness is an important step towards integration and collaboration between identity states.